All right, you guys ready to get started?
Yeah, let's go ahead.
Great. All right. So, good morning, everyone, and thank you for being here. My name is Nick, and tonight I'm joined by Alpna Doshi. Alpna spent 30 years in technology and operations leadership. She was CIO at Royal Philips and at Reliance, and an operating partner at Thoma Bravo. She now runs Stralynn Consulting, and today we're going to be talking about a specific problem, basically that clinicians spend more time on paperwork than they do with patients. Prior authorizations take weeks. Nurses are leaving the profession over administrative load, not over actual care. Healthcare has been buying software for 20 years and it's only gotten worse. Today, we're going to be talking about the intricacies of healthcare operations and how healthcare organizations can use AI agents to take on the work that's burning out their staff. Not so much the hype, but the actual plumbing, the paperwork, the prior auths, the things that make nurses want to quit. So Alpna, let's get into it.
Thanks, Nick. It's great to be here, and I'm really looking forward to how the transformation of healthcare delivery system to move past the software pilots and start using AI as an actual infrastructure to fundamentally heal. That's top of mind for me.
Yeah, great. So let's just dive straight into the deep end. We know that doctors and nurses are completely underwater with everything that they have going on. They're dealing with staffing shortages, and a massive chunk of their day is swallowed up by just typing clinical notes and logging compliance metrics and fighting legacy software interfaces. From your perspective and what you're seeing across the industry, how do you see how severe this administrative burden is? And how do you think AI can actually help give these teams their days back?
Well, the 40% administrative tax isn't just a statistical exaggeration. It's a full-scale operational crisis. It's an emergency. We have inadvertently abused the quality time of our brilliant clinicians into administrative aspects where they're forced to fight rigid EHR interfaces and messy compliance codes, taking away valuable time from showing perhaps more empathy time to patients in front of them. So, for example, for floor nurses, this looks like an endless logistical friction. They are constantly, if you see on the floors, are interrupted to update shift handoff reports, log repetitive data, and chase down equipment. The invisible burden drives massive cognitive exhaustion and burnout. I mean, that does have an indirect impact on the patient care.
Yeah.
So when we started looking at this, Nick, at Stralynn, you cannot fix a systemic capacity crisis by asking an already exhausted workforce to click boxes faster or work harder, right? We deploy specialized operational agents that act as a digital backend support layer. Now, these agents, they would silently handle the tasks like tracking patient flows, predicting discharge timelines, and then even things like coordinating room readiness across departments. By removing these repetitive tasks, they might be just 15 minutes, but it's a 12-hour long shift. Now, if we can give nurses hours of their day back so that they can focus on direct, high-value clinical care, wouldn't that be great? I have a friend whose wife is the head of nurses, and she has absolutely zero time. He says by the time she comes back home, she's so exhausted. Let's give them some relief through this.
Yeah, I agree. And I think that the distinction is crucial. Like when you mention agents, right now the market is saturated with these generative AI tools and these listening widgets that run in the background and record conversations. What would you say makes the Stralynn agent a little bit different or more like fundamentally different than the standard tools that these executives are seeing today? What can it actually do in the hospital?
I mean, you bring in a very important point. Indeed, I mean, it's so much hyped that everyone almost knows every little bit of AI, if you think about it. So, where is the differentiator? I mean, this is the core shift. Right now, most healthcare software is passive, trending towards what more can be done. And this is where, you know, we would really like to jump in and make the shift. So if you look at an ambient scribe is fine, but it's really an order taker. It listens and transcribes, and the doctors are left with big, massive notes that they still have to manually review and clean up. So a Stralynn AI agent is execution oriented. It's not just a document. It's a proactive digital entity built with context and intent. So let's take an example when an agent recognizes that a patient wants to order a specific scan and update a dosage. You walk in there with a knee problem, your right knee problem needs an MRI, and a prescription needs to be updated to 500 mg of naproxen. The agent doesn't just type those words down into a summary transcript. It automatically logs the draft order inside the EHR. It instantly checks the patient's specific insurance policy rules, which are, we'll talk about that hopefully in the next bit of conversation. And then it kicks off the prior authorization workflow and places the script directly into the pharmacy queue. So I'd like to nail down this point that we are moving from passive transcription, really highlight that point, massive passive transcription to autonomous execution. And that's where it will make a big difference to have these AI agents come in seamlessly and take over some of the back-end work.
Yeah, and I think you're right. I think that's something that we should dig into more because that is a massive pain point, the prior authorizations. So right now it's just a game of telephone between billing departments and insurance companies, and it basically just stalls patient care. How do you think this kind of agentic workflow will apply to this bottleneck?
Well, prior authorization is exactly where operational momentum goes to die. It's an incredibly manual process bogged down by hidden data silos and constantly shifting insurance guidelines. This is where an automated agentic workflow shines. The agent pulls the clinical intent and the necessary medical documentation directly from the patient's chart. It maps that data instantly against the latest policy guidelines. And please note, these keep changing. So there is enough theoretical work that happens in the background. It then populates the paperwork perfectly and then submits it. Now, if the insurer requests more info, the agent doesn't let the request collect dust in a manual inbox. It queries the EHR itself for the missing, say, lab or medical history and fires it back immediately. I'd like to emphasize, the Stralynn Agentic AI cuts down insurance authorization timelines from days down to minutes. And we have such excellent partners working with us who are domain experts in this industry, like ExactRx, who cuts down on billing times and all of these things. Getting patients treated faster and reducing their frustration while securing and protecting the hospital revenue cycles. And if I even think about an example, say the agent submits a prior authorization request for a patient's specialized scan. 10 minutes later, the insurer's automated gateway requests a missing lab report from 6 months ago. Instead of letting that request, saturate in billing boxes, the Stralynn agent autonomously queries the EHR backend, pulls the correct lab result, and then sends it back to the insurer immediately. Definitely, there's a huge reduction in the cycle time.
Yeah, I think that's really interesting, and especially the fact that you guys basically keep everything up to date without having any input from the clinicians, basically just by keeping up to date with these different guidelines that are constantly changing and constantly evolving. So that's really interesting. Yeah, so if we kind of shift into the more autonomy in healthcare, like clinical or financial, basically a lot of eyebrows go up, and a lot of people start thinking about safety and data privacy. How would you say that Stralynn ensures these autonomous agents operate safely, and how do you make sure that the doctors keep the final say in what is happening?
I'll start with a simple, a simple example. Is the dog walking the owner, or the owner is walking the dog? And it's often, if you imagine the park scenario, what I'm getting to. Safety, coming back to this point, is safety is non-negotiable. AI certainly has the hiccups. You can't have AI control your world. You cannot control the human beings. And for us, the AI architectural philosophy is built on controlled autonomy. The AI agents are tasked to do the heavy lifting, the data gathering, the analysis, and the drafting, but they do not make the final unchecked executive decisions. We use a strict human in the loop guardrail. And this is what is important to note, because this is not only applicable to healthcare industry, but every industry, because there could be hallucination and other hiccups. A machine is still going to be a machine, even though it's evolving significantly. But the agent here surfaces its finished work, its rationale, and the context clearly on the clinician screen. Doctor or nurse then reviews it and then signs it off with a single click. On top of that, when we tackle data debt by ensuring all patient data is completely secure, ring-fenced, and fully compliant with the global privacy standards, so the AI reads the context strictly within the health system's secure perimeter, ensuring total data traceability and sovereignty. So before any, say, an MRI order, taking our previous example, or any prescription is transmitted to a pharmacy, the finished work is certainly the more longer duration, mundane, heavy work that is then displayed by the agent, and the context clearly on the clinician's dashboard is then comes up, and it's signed off. So that's how we make sure that human in the loop guardrail is definitely in control of the context.
Yeah, that's I think super important, and it goes back to bringing back the human connection in the physician's office, and more of the cultural side of this technology and how that can help improve things. You often are saying that true success means helping doctors look at their patients instead of the computer screen. And you brought that up earlier, that doctors are looking at their computer screens less, and they'll have more understanding of what is going on. But how does it look like in real life, and how does that change the experience for the actual patient in the doctor's office?
And this is where we actually started talking about it. How can patient care be different? And experience is, again, a very heavily used word. So I would like to introduce a new metric, what I call the eye contact metric. Experience is about eye contact. In the boardroom, I've seen we talk a lot about ROI, overhead reduction, and billing speed. But the ultimate measure, and I've been through so many transformations, but the ultimate measures of a truly successful patient care digital transformation is human eye contact. When you walk into an exam room, it's powered by a back-end agentic infrastructure. And this is what I'm talking about, this transformation world or the patient that has to undergo much better experience with the eye contact. And you see the physical environment changes completely. The doctor or medical assistant isn't standing with their back to the patient, typing frantically into a keyboard to finish charts before the clock runs out and get more and more patients come in and out. In the patient eye contact scenario, the technology completely takes over all the background work. The doctor can sit down, look the patient in the eye, and truly listen to their concerns. I mean, I've seen so many young people and old people all go into a doctor's room expecting, a much better interaction, empathetic, listen to the concerns. They know the doctors know how to do their jobs of operating, surgery, or whatever they have been trained on. But for them, it is about looking into the eye of the doctor and vice versa, where they feel safe, heard, and valued. And the doctor is reminded of exactly why they went into medicine in the first place. When a medical professional has time for patient eye contact, that's the true power of healing the system. And an AI agent enables that. So I would say this is where I truly feel that the true power of healing the system is actually leveraging the well-designed AI agents in the patient care environments.
Yeah, I agree, and I love that metric, the eye contact, and because that's what I think the doctors are looking for as well. The physicians, they want to give their full attention to the patients that are in their office, but they have so much on their mind with all the back end of everything. And I think you're right that this kind of task is definitely something that an AI agent would be able to take off their plate.
And I just wanted to chime in on one more point is that, while standards are evolving in this particular area on usage of AI and AI governance and cybersecurity kind of topics, we're a member of NACD, the North American Corporate Directors, and in Nashville, several panel discussions have been going on this very healthy topic, hosted, at locations like Vanderbilt and Belmont and others. So it's something that requires a lot of awareness so that more standards can come about. And I'm proud to say that, the NACD is also doing a very good job. The Nashville Healthcare Council is doing some great work out there.
Yeah, that's great. And I think if we shifted to more the outside of the doctor's office to even like the healthcare executive, because I think they'll have a lot of questions. They'll be the ones that are making the final decision on a tool like this. Where do you see the shift from like a basic point solution to a true agentic infrastructure? Where do you think what do you think the best blueprint is so that they can land this transition?
And this is a big industry. Healthcare is, all over the world, which is necessary for every human being. The golden rule is to start where the administrative friction is highest, but the direct clinical risk is the lowest. That's a good starting point. Don't try to use AI to change patient diagnostics on day one. Instead, target the back office and the operational bottlenecks that crawl every single day. That are the frustration factors as well. things like automated prior authorizations, discharge coordination, and floor logistics. This allows you to safely clear out legacy data debt and silos and prove massive financial ROI to your board and build deep operational trust with your clinical staff before you scale the infrastructure deeper into the enterprise. And post that, you gradually test out the waters on more of the clinical side of the patient care, so that it is gradual, and the AI, as we all know, keeps evolving and learning through the process. Right?
Yeah, I think that's a brilliant strategy, and I think it's on the mind of every healthcare executive. And I think that the intersection between just the lowest clinical risk and the highest administrative friction is definitely the best place to start. I think you've probably seen that with working at doing like restructuring at the Royal Philips and Reliance and stuff like that, and overhauling their systems and stuff. Yes, I think that's a brilliant strategy. So I think those are all the questions that I have. Did you want to add anything onto that? If not, we can go to the Q&A.
Yeah, no, I would say that I think these are such burning topics. We need to have continued discussions on it at various forums and help with the standards and guidance so that more and more time can be spent on patient care, good quality patient care. And Stralynn's Agentic AI, is certainly striving towards providing that capability along with our partners in this particular domain.